Sri Lanka is facing an unprecedented threat with the spread of the Delta variant of the COVID-19 pandemic in the country. However, Sri Lanka's vaccination drive is on full swing. A very good evening and welcome to Primetime News on TV1. We've got the latest of news lined up for you from here at home and across the globe. But before we take a look at those stories in detail, here's a look at your top stories for tonight.
Discussions underway to provide a third jab of the vaccine to citizens. What is the solution to the shortage of milk powder? Teachers and principals to take alternate action from tomorrow. 2020 Tokyo Olympics conclude. The United States tops the gold medal tally.
And a look at those stories in detail now. Senior citizens above the age of 60 living in the Western province and have not yet received the first dose of the COVID-19 vaccine will be vaccinated through the course of 3 days starting from the 10th of August. The Government Information Department requested such individuals to register themselves for this via the hotline 1906. Meanwhile, authorities have focused their attention on providing a third dose or a booster shot of the vaccines to the general public. Now, this responsibility falls on the Task Force for Prevention of COVID-19.
The President drew this matter to the attention of the task force when the task force convened.
At
the meeting of the task force held the day before yesterday, discussions were held on the possibility of providing a booster shot or a third dose of the vaccine to the population of the country. At the meeting, the President directed the committee to look into this matter and to take steps to procure the vaccines required.
The administering of the first and second doses to the population has not yet concluded. Why are we rushing in for a third jab?
We are looking into this requirement, and if there is such a requirement in the country. But we do know that there is still a section of the population in the country who have not received either the first dose or the second dose of the vaccine. We hope to prioritize these people. If we are providing the third dose of the vaccine, it will mostly be needed for the frontline healthcare workers.
The administering of the first and second doses of the COVID-19 vaccines were conducted at a number of inoculation centres in the island today. Residents of Colombo who have not received a single dose of any vaccine were given the vaccine today at the Sugudadasa grounds. According to our correspondent, despite the heavy showers, many people were lined up to receive the vaccine. The first and second doses of the Sinopharm vaccine were administered to residents of Colombo above the age of 30 at the Vihara Mahadevi Park today. This vaccination centre, managed by the Army, functions 24 hours a day. The first and second doses of the Sinopharm vaccine were also administered at the Army Bodhi Raja Ramaya Vihara today. The vaccine was administered to people above the age of 30. 1.86 million doses of the Sinopharm vaccine were brought down to the island today. Sri Lanka has now received a total of 14.7 million doses of the Sinopharm vaccine.
The total number of deaths.
The epidemiology unit of the Ministry of Health says in comparison to the first and second wave of COVID-19 in the country, the death ratio during the third wave of the virus has increased by 100%.
How did the death toll rise so fast?
The epidemiology unit pointed out that this increase is based on the statistics with regard to COVID-19 deaths in the country until the 31st of last month. The death ratio during the first wave of the virus stood at 0.38. During the second wave, it was at 0.64. The death toll saw a rapid increase as the Delta variant entered the country. Patients receiving treatment at ICUs increased drastically. Therefore, the government has requested the general public to get vaccinated. While 98 COVID-19 deaths were reported last night, 94 deaths have been reported so far today. With 2,956 COVID-19 cases being reported today, the total number of cases in the country rose to 320,652.
Situation at hospitals.
It is reported that the congested situation in hospitals has gradually reduced as patients have been advised to undergo home quarantine and admit themselves to intermediary treatment centres.
Patients at homes.
PCR positive වෙච්ච hari rat.
If people aged between 2 and 65 with no long-term ailments have tested positive for the virus with minor symptoms, we have advised them to undergo treatment at their homes. After the test report is out, the medical health officer or the PHI of the area will determine whether this person is eligible to be treated at home. After such person has been identified, their data will be entered into a system. When you dial 1390 on your mobile phone, that center will give you a call. You cannot directly call this center. When you call and register yourself at this center, a doctor will check your condition daily over the phone. Steps will be taken to hospitalize you immediately if your condition is becoming worse. If you are an expectant mother for more than 25 weeks, you will not be able to undergo treatment staying at home.
ඔබට නිවෙස්ගත රැක බලා ගැනීමට අයත් වෙන්නට බැහැ.
The hotline.
The 1999 at the Ministry of Health has been designated to seek advice when you encounter any suspicious symptoms or for being positive of the virus.
An increase of child patients.
Health officials say that there is a rapid increase of children contracting the virus. According to Director General at the Lady Ridgeway Hospital for Children, Dr. G. Vijay Surya, 160 children are currently receiving treatment at the hospital. However, the maximum capacity at the hospital is 120. Dr. G. Vijay Surya said due to the increased capacity, one story at the Ayurveda General Hospital in Rajak area has been used to treat children. Many countries around the world, including Sri Lanka, are battling the dangerous third wave of the COVID-19 pandemic. According to reports in the United Kingdom, there is a reduction of deaths during the third wave compared to the deaths reported during the second wave in the country. According to foreign research, vaccinating 45% of the entire population in the UK has been named as the reason for this drop in COVID-19 deaths. So far, 64% in the UK have at least received one dose of a vaccine.
Opposition leader Sajid Premadasa says that the government is not closing down the country because they will have to provide relief to the general public if they do so.
The opposition leader made these remarks after he called on the chief incumbent of the Debaravawa Manik Raj Mahaviharaya, Venerable Thangalle Jinaratana Thero.
Specialists and others in the health sector have already issued warnings on the matter. The government says that they will not shut down the country. It is because then they will have to provide relief for the general public. The government must have enough funds to provide such relief to the people. A very serious situation has arisen due to COVID-19 Delta variant in the country. The number of patients that can be accommodated in hospitals has also been exceeded. This government came into power to rule the country in a planned manner. However, they were not able to provide any sort of planned solutions to the country's problems. Patients in hospitals are currently facing the challenge of obtaining an adequate supply of oxygen.
We have been saved to a certain extent because the President is very carefully and responsibly formulating a program to address this situation. Many of the deaths reported are of people who have not obtained a single dose of any vaccine or people who have taken the first dose and not taken the second dose of the vaccine.
We will have to accept that there was a delay in bringing down the vaccines. Even during the last 1.5 years, we said that the vaccine is the only solution. There was a delay there, but even after that delay, now we can be happy that the vaccination program is being conducted well. We believe even in the future, steps will be taken based on the advice of health professionals.
No country in the world has used egotism and stupidity as a mode of treatment for COVID-19. In our country, the vaccination program is mixed with egotism and stupidity. Listen to the advice of health experts. If the Presidential Task Force is continuing to operate, at least appoint a person like former Director General of Health Services, Dr. Anil Jasinghe, to lead the task force.
Doctors have called for a lockdown, but the government has rejected that. At least inform the country the reason you rejected this. The responsibility has been vested with the Presidential Task Force. When looking at the number of deaths, we had an opportunity to control the spread of this virus since April 2020, but that did not happen. So this committee has to be held responsible for these deaths.
විශේෂයෙන්ම වගකියන්ට උවමන.
This government is taking unsound decisions to combat this pandemic. During the time in which the vaccine should have been administered, they gave people a tonic. When the opposition asked for the vaccines to be brought down, the government laughed at us, saying that the World Health Organization has still not confirmed this. Because of these wrong policies of the government, thousands of people in our country are losing their lives. You cannot turn back these decisions. You cannot get back the lives lost in the country by administering 2, 3 or even 4 doses of the vaccine.
Let's now take a look at the COVID-19 situation across the globe.
Experts fear Indonesia, considered one of the world's COVID-19 epicenters, is now a high-risk hotspot for the emergence of a new COVID-19 superstrain. An alarming second wave in the country has been largely fueled by the highly infectious Delta variant, which was first identified in India's out-of-control outbreak. The Department of Evolution and Genomics at Oxford University in the UK said, quote, uncontrolled epidemics are really bad hotspots for the evolution of variants, unquote. The local government has originally hoped to achieve the ambitious vaccination target by the end of the year. Unfortunately, problems with supply meant they missed the goal. The result has been a tragic loss of life, with the death toll in Indonesia surpassing 100,000 since the pandemic began. A staggering 40% of them have been in the past 5 weeks alone. Total infections in Indonesia, the fourth most populous country in the world, have passed 3.5 million. Saudi Arabia will begin receiving Umrah pilgrimage requests from vaccinated foreign worshippers starting from tomorrow. According to the report, permits will initially be granted to 60,000 Umrah pilgrims per month, but that number will gradually be increased to 2 million per month. It further added overseas pilgrims would have to include authorized COVID-19 vaccination certificates along with their Umrah requests. Italy is introducing a digital certificate for access to some services and venues in a bid to curb infections. The Green Pass will allow access for people who have had at least one vaccine dose, have recovered from coronavirus, or who have tested negative within 48 hours. Italy joins several other EU countries.
Is there really a shortage of milk powder in the market, and if so, what are the reasons for this? Now, we delved in deep to find out the true reasons that led to this situation.
A sudden milk powder shortage in the market usually precedes a proposal for an increase in prices. The companies are requesting for milk powder prices to be increased. The government is still thinking about it. The people are left helpless with no milk powder in the market.
දැන් සතියක් වගේ ඉඳලා කිරිපිටි නැහැ මේ ගොඩක් අය එනවා හොයාගෙන පොඩි අයට කිරිපිටි දෙන්න විදියක් නැහැ කියලා තමයි එන්නේ.
ඒක කියන්නේ මිල පාලනයක් නැතිකම වෙලාදී රටේ වෙලා තියෙන්නේ මිල පාලනයක් නෑ. පාරිභෝගික අධිකාරිය නිදි රටේ.
දෙමාපියන්ට වැඩිය පොඩි අයට තමයි ඉල්ලගෙන එන්නේ ඉතින්. දෙන්න නැහැනේ පිටි ඉතින්. රටින් කිරිකීම නවතිනවා නම් ඉතින් රටේ නිෂ්පාදනයක් ඇති වෙන්නම ඕන.
කිරිපිටි නම් නැහැ දැන් සති ගානක් තිස්සේ.
ඉතින් ඩොලර් ගණන් වැඩි වෙලා කියලා කිරිපිටි නැහැ කියලා කියනවා කම්පැනි වල.
රට දැන් අගාදිරි වැටලාද?
කොහෙවත් නැහැ ගන්න දැන් හැමතැනම කඩවල අපි කිරිපිටි හොයනවා නැහැ. ඉතින් දැන් ප්ලේන් ටිපි බීන්න තමයි තියෙන්නේ.
මේ උදේ පාන්දර ගාවේ කිරිපිටි ගන්න. එක තැනකවත් හැටන් එකේ කොයිවත් කිරිපිටි නැහැ.
The monthly consumption of milk powder in the country is about 6,500 metric tons. Annually, $360 million is spent for the import of milk powder to the country.
The import of milk powder has been stopped because of the lack of dollars or some other reason, and in a week we will not be able to find a single packet of milk in the market. We spoke to the companies and they said that it costs them about 1,200 rupees to unload a kilo of milk powder into the country, and they asked us how can they sell it at 900 rupees. Now when a shortage of milk powder like this comes up, the government could say, don't worry about milk powder, drink fresh milk. We will send a fresh milk truck every morning. I wonder if the minister can say this. Please reveal what the true issue behind this milk powder shortage is. In the end, the ministers might probably say, we don't need milk. Let's drink things like kottamalli to boost your immunity. They will definitely say something like that. We made requests to increase the prices of milk powder since January. We informed the Consumer Affairs Authority that we cannot continue to maintain the current prices. The reason for this is in the past a kilo of milk powder was $2.8. This was when the dollar was selling at 182 rupees. But now a kilo of milk powder is at $4.2 and the selling rate of a dollar is 210 rupees. All these companies are suffering massive losses. The companies are suffering a loss of about 1,500 million rupees every month if milk powder is continued to be sold at 945 rupees. If we are to sell it at the control price, we have to suffer a loss of 270 rupees. Companies that import milk powder had requested the Consumer Affairs Authority to increase their prices by a large amount. But we cannot allow such an increase to be made as the general public has made many sacrifices. Milk powder companies had made large profits in the past when milk prices were low. When there is a calamity, they too must bear a share of it. The easiest way is to allow the price to be increased by about 200 rupees. Then the market will fill up with milk powder packets. If we permit that to happen, the people who have suffered in the past will continue to suffer.
What is the solution to this issue?
Sri Lanka only produces 40% of the milk that we need. We need to increase that to 100%. It is only then that we will stop importing milk from overseas. We need to satisfy consumers, but we also need to be self-sufficient in the dairy industry in Sri Lanka. Becoming self-sufficient in the dairy industry requires stopping milk imports. That is what we are trying to do. We will not be able to do it immediately, but we are planning this program so that we can reach self-sufficiency in the dairy industry within the next 2 to 3 years.
If boosting local dairy production is the solution, are local dairy farmers being encouraged? The main reason for the sudden shortage of milk powder in the market is the request for a price hike and the delay in the government's response to it. The Ministry of Trade is of the stance that prices will not be increased. This will be a concession to the consumers, but the shortage of milk powder in the market will adversely affect the consumers.
The main issue that affects the shortage of milk powder in the market is the lack of foreign reserves in the country. That is something that we have continued to highlight in the past. When milk powder is purchased with dollars and brought to the island, the price of these goods increased rapidly. The cost is high. We are facing this issue today because of the lack of foreign reserves. If we do not find both short-term and long-term solutions to the lack of foreign reserves, many more goods may be added to this same issue that we are facing.
Parliamentarian Dr. Harsha De Silva said that there has been a collapse starting from the market all the way to the treasury of the country.
මිනිසුන්ට ජීවත් වෙන්න බැරි තරමට බඩු මිල එක පැත්තකින් ඉහළ යනවා ආදායම අනිත් පැත්තෙන් කඩාගෙන වැටෙනවා.
The prices of goods are rising on the one hand while the modes of income of the people are falling on the other. There is also no gas. Only a limited amount of milk powder is being sold even at supermarkets. There is a huge issue in bringing down fuel without third-party confirmation on LCs. They are saying that we have alternatives, but no one is saying what those alternatives are. By the 31st of July, the official foreign reserves of the country had dropped to $2.8 billion US. That is about $380 million US worth of gold. When we remove the gold, the amount of foreign reserves we have is only $2.35 billion US. This is the lowest that the country's reserves have been. We calculate the reserves based on how long it can sustain imports. We only have reserves in our country to pay for imports for another 1.6 months. So if they are saying that we have an alternate way out, I would like to request the government not to pull the people of this country down even further just because of the extreme stance that you have taken. Let's think that China comes and says, okay, we will save you. But to really save us, we need at least $10 billion US. Because restructuring requires an amount like that.
මොකද ප්‍රතිව්‍යුහගත කිරීමක් කියන්නේ ඒ වගේ සහනයක් ලබා ගැනීම. ඉස්සරහට චීනෙත් එක්ක නේද වැඩ කරන්නේ. දැන් චීනය වැඩි
China has given the most amount of loans to Zambia in Africa, not Zimbabwe, but Zambia. That country has gold, silver, cobalt and many more resources. Zambia cannot pay the loans back now. China told them, don't speak to us about it. China said, if we are to help you, we need these gold mines, these silver mines, these cobalt mines and copper mines. As a country, we will have to think about what we will have to give away if we really want China to help us.
ගැඹුරින් හිතන්න සිද්ධ.
During a media briefing held today, the convener of the Voice Against Corruption, Vasanta Samarasinghe, revealed that plans are underway to lease out 33,000 acres of the Trincomalee port to the United States of America.
A cabinet paper has been drafted to hand over the Trincomalee port to the United States, just like the Hambantota port was handed over to China. The government conveniently uses the term investment instead of addressing it as a sale. The government is taking steps to implement their plan that was introduced on the MCC agreement to develop a corridor from Trincomalee to Negombo. It was revealed that the cabinet of ministers in our country have also made arrangements to support this. Against a backdrop where the oil tanks, along with 33,000 acres of the land at the port, are to be handed over for the development of a refinery, plans have already been drafted to hand over 40% of the conversion of the Kerawalapitia power plant to an LNG power plant to an American company. Discussions are also underway to convert the Norochole coal power plant into an LNG power plant. When this is handed over to the American company as well, the corridor will inevitably be created even without the implementation of the MCC agreement.
අමරිකානු සමාගමටම දුන්නහම අන්න කොරිඩෝව දිගටම හැදෙනවා. නෑ කියපු MCC අස්සන් නොකරම ඇමරිකාව කන අමරිකන්නෙත් නෑ ටොකු අනින්නෙත් නෑ කැබිනට් පත්‍රිකා දාලාද රටේ ජාතික සම්පත් විකුණු වැඩේ කරමින් තියෙනවා. ආණ්ඩුව වහාම
This cabinet paper that was drafted with the intention of selling state assets to foreign countries must be withdrawn immediately.
කැබිනට් පත්‍රිකා වහාම අකුල ගන්න.
Hope for the future.
Gammatta. For the people, by the people, with the people. Do your online shopping with Sambole.lk. Home delivery and pickup now available.
Sambole.lk.
Commander of the Army, General Shavendra Silva, immortalized the legendary war hero Lieutenant General Denzel Kobakadua and 9 other war heroes by opening the Denzel Kobakadua Memorial Museum at Arali Point in Kites, the very location where they fell victim to an LTTE landmine blast on the 8th of August in the year 1992.
To coincide with today's 29th commemoration day of late Lieutenant General Denzel Kobakadua and his accompanying team, Major General Vijay Vimalaratna, Rear Admiral Mohan Jayamaha, Lieutenant Colonel H.R. Stephen, Lieutenant Colonel G.H. Aryaratna, Lieutenant Colonel Y.N. Palipana, Commander Asanga Lankatilaka, Lieutenant Colonel Nalin Dialvis, Lieutenant Commander C.B. Vijaypura and the soldier Private W.J. Vikramasinghe. A memorial conducted at Aralia Point Kites was held under the auspices of General Shavendra Silva. The event was held in accordance with COVID-19 health guidelines. A museum that houses parts of the vehicle that the war heroes were traveling in when they were hit by a high-pressure bomb was also inaugurated during the event.
You might remember the Sena caterpillar or the fall armyworm. Now this Sena caterpillar, this pest, was the reason behind the destruction of almost the entire maize cultivation in Sri Lanka. Once again, the Sena caterpillar is back, but this time its target is the Kurakkang cultivation here in Sri Lanka.
Not only Kandayaya, but several villagers including Maspana, Hitikumbura and Yalagamua under the purview of the Uvaparanagama Divisional Secretariat have been affected by the Sena caterpillar menace since 2019. Maize cultivation in the country was severely affected in 2020. Ever since then, the Sena caterpillar menace has spread to 8 provinces, including the northern, eastern, central, Sabragamua, southern, Uva and north-central provinces. Sena caterpillars were also discovered in the Gampaha district of the western province. Farmers were left starving as the Sena caterpillar destroyed their maize cultivation. However, the farmers have not received proper compensation as yet. Against such a backdrop, the Sena caterpillar has now begun to destroy Kurakang cultivations as well. Kurakang cultivations in Kandayaya Valapane continues to be destroyed. Why aren't the authorities looking into this issue? These farmers have not been paid compensation for the loss of their maize cultivation. Where will the Kurakang farmers end up now? News First inquired into this matter from the Director General of the Department of Agriculture, Dr. Ajanta De Silva. Dr. De Silva said that the agrarian officers in the Nuwara district have been informed of the situation.
During a media briefing today, teachers' trade unions said that they will take alternate action from tomorrow if a solution is not provided to the salary anomalies of teachers and principals during the cabinet meeting tomorrow.
We will not stop our struggle at any circumstance merely because of trivial solutions like cabinet papers or promises they made with the budget. The government is assuming that our trade union action can be called off by scaring us by issuing notices, filing court cases, taking us into police custody and inconveniencing us. I would like to tell the government that we will not let that happen. Therefore, we have decided to stage demonstrations as a collective of trade unions from next week onwards.
අපි ලබන සතියේ සිට සියලු වෘත්තීය සමිති ඒකාබද්ධ කරගත්ත ඒකාබද්ධ සටන් වලට අවතීන වෙන තීරණය කළා තිබෙනවා. මේ අරගලයේ තීරණාත්මක දවස.
Tomorrow will be a decisive day of this trade union action. Tomorrow is Monday. We must be provided with a solution to this problem during the cabinet meeting tomorrow. A protest march organized by parents of students was staged in Kandy. 25 people were served with summons. When being summoned, it was revealed that the name and the address was incorrect. Moreover, they hadn't even engaged in the demonstration as they were undergoing quarantine during that period. How did they obtain the names of these people? We would like to clearly say that we are ready to face the actions that would be taken by the authorities.
අපි පැහැදිලිවම ඒ අධිකරණ ක්‍රියාමාර්ග වලට මුහුණ දෙනවා කියලා කියන්න කැමතියි.
පොලිසිය භාරමේ ඇමතිවරයා දැන් මේ ක්‍රියාව මාසංග රත්නයේ මත මේගොල්ලෝ ඒක කියවන්නේ මේක මේ නොමග යවීමක්ද?
පැහැදිලිවම අපි දන්නවා මේක තමයි ආණ්ඩුව දිගටම කියන්නේ. මේ රටේ ගුරුවරු බඩි ගන්නවා කියලා.
We are very much aware that the government repeatedly says that teachers in this country are provided with salaries. Not just teachers, everyone receives a salary. People must be paid. That is what their livelihoods depend on. They tell the Mahasangha that they haven't provided salaries in around 1.5 years. Paying your employees is a responsibility you bear. It must be done. It is mandatory. Even the minister claims so while receiving a salary.
මේ ඇමතිවරු කොවිඩ් නිසා ඔවුන්ගේ වරප්‍රසාද කිසිවක් අඩු කරගෙන නැහැ. එහෙමනම් ඔවුන් ආදර්ශය දෙන්න ඕන අංක 1ට.
LK. We as a country are going through unprecedented times, and in these troubled times it's very important that we adhere by the guidelines that have been issued by authorities. Stay at home, stay safe, and God bless. I'm Charlotte Benedict for the Newsfirst team.